My name is Andrea Kozlowski. I'm 29 years old and I'm a registered nurse in an ICU in Saskatoon.
Hi, my name is Whitney Walker Ross. I am 27 years old and I'm a registered nurse at the Surgical Intensive Care Unit in Regina, Saskatchewan.
My name is Dr. Hassan Masri. I am 37 years old and I am an ICU physician and associate professor at the University of Saskatchewan.
My name is Travis Bolin. I'm 32 years old. I'm an advanced care paramedic with Regina EMS, and I've been a paramedic for about 10 years.
I'm Dr. Susan Shaw. I'm a critical care physician in Saskatoon, where I've worked for 20 years. What I want everyone to know is that we can do this. We can do this if we all pull together and we all keep each other safe. We all do what's required and directed of us to follow all the public health measures and take care of one another. If we do this, then we will get through this and we will get through to the new normal. I don't know exactly what that looks like, but I'm confident and optimistic about what it does look like.
I want people to know that COVID is real, that COVID is serious, but that COVID is not an indefinite reality.
I just want people to know that we're working hard to keep you safe, and it's a team effort, kind of all around, right? We need people to continue to follow the guidelines that are in place, and to keep each other safe, and just be cognizant that if we make some sacrifices now, that this can end sooner, and that we can all go back to what was normal a year ago, sooner than we expect.
That this is real and people are sick when they come into the hospital, and if you need an ICU admission, these patients are tough and difficult and complex to care for.
I've seen people make comments saying, just get more nurses to come and help. It's not that easy. You can't teach a nurse how to work in the ICU in a day or a week. There's exams, there's clinical hours that you have to put in, there's simulation labs, assignments, and so much more. It takes so much more to do that. Same with the physicians as well. You have your intensivists, right? They work 7 days a week and they're rotating through all the ICUs. That's a subspecialty on its own compared to other physicians.
When we look back in many years from today, will be a nightmare that lasted a very short time, very, very short time compared to our lifespan. And I do want people to be able to look back, to be alive to look back. I want them to be able to be with their families so they could all collectively look back and say, boy, that was a tough year. But I also want people to look at a lot of the positive things that could come out of COVID-19 and not focus only on the difficult parts of COVID-19. I also want people to know that healthcare workers will put their lives on the line literally to save your life, but it is really important that you do your bare minimum or your best actually to help them out.
Even though we've slowed down, the world doesn't stop. Like, people are still getting sick with what we see every single day. And it's made our whole aspect of care change.
Hopefully, this whole COVID thing will just be a memory and a story that we can tell, when I'm an old paramedic and we're all sitting around the table telling stories that we can just say, hey, remember that one time, but that's just what I want, just keep everyone safe. There's some small sacrifices we can make. We've made them in our workplace. We've made them in our own homes, and if people can continue to make those small sacrifices, I think we'll be better province at the end of this, and we'll be healthy and happy, hopefully come 2021.
By January, and sadly, I think that we're going to see many more people in Saskatchewan who do know someone who's been affected by, rather than it being, something in the newspaper. I think it's going to be something that people have been personally impacted by. So Yeah, I think that's sad to have to say, isn't it?
This is not a fight between COVID-19 and healthcare workers. This is not a fight between the government and COVID-19. This is all of us versus COVID-19. And yes, you're right. It's very difficult to say that sentence that we're approaching 1 year of COVID-19. But the good news is you won't have to say it again. A lot of evidence would suggest that maybe by the middle of 2021, or towards the end of 2021, this would be behind us, and that things would probably be going to not exactly the same normal, but very close to it, especially if the news out of all these vaccines continues to be this promising.